Good morning, everybody. It's great to welcome you to our 7th European Connected Healthcare Alliance event. And we've had a series of these events looking at digital technologies, and today we've got a focus on apps. And for quite a long time people have been saying, let's have a look at apps, let's think about how they fit into the health system, how citizens can access them, and how we can help people to become digitally literate so we don't just leave them on their own trying to work things out for themselves. So I'm just going to do a short presentation. I'll whiz through some of the slides because we have started slightly later. And we've got some brilliant speakers today and some brilliant exhibitors around the room, so do make the most of being here. So some of you will know that we're changing our name. So I'll now be introducing myself as Chief Executive as the Innovation Agency. Hopefully we do what it says on the tin. We help innovation to thrive in healthcare, in local government. We work with industry partners to bring your products into our market and hopefully spread them at pace and scale. Now, some of the people who are exhibiting and some of the people who are presenting will know that it's quite tough to get an innovation into healthcare, but we're here to help you do that. So if you're a business here, you've got something you think this is fantastic, I've got the research that shows it works, we're here to help you spread that innovation. So we want to improve health outcomes. This is part of our mission. How do we enable our citizens in this region to be as healthy as possible? And you'll know if you're in health or in public health, our outcomes for our citizens in terms of healthcare are really poor. We have people with COPD, and we're going to talk about that today. We have people with all different cardiovascular diseases. We have a lot of strokes, and we've got exhibitors looking at how we can tackle that. So we really need to work together to improve our health outcomes. Health is a publicly funded service, and we want to make sure we get the most out of every pound. So some of the digital products and apps we're going to talk about today can help citizens to access healthcare in a very effective and a cost-effective way as well. So we're looking at how we do that right across the system. And one of our aims is to increase economic growth into the region. So if you're a business, you've got a great product, we want you in our region. We want us to be using the product, and we want you to be manufacturing your product in our region. So that actually we get people working, we increase money coming into the region, and we all become healthier as a result. So this is our new business plan moving forward. You'll see that digital health is one of the key strands of it. It's very simple. There are 4 goals, and one of them is to adopt digital innovation across the region. So we're here to support you, to take your great ideas and to help you to put them into practice across the region. And our team are scattered all around the room. So if you want to chat to somebody, there's lots of people with a different badge of this, like a metal badge saying North West Coast on, because we are still called North West Coast Academic Health Science Network at the moment. So seek them out and we'll chat to you about how we can help you to get your products into practice. So we run these events in conjunction with the European Connected Healthcare Alliance, and this is a membership organisation, and as well as public sector bodies like ourselves being members, there are a lot of business who are members and who we work with. So anybody that's in an e-health or an m-health, a mobile health space, we do try and work with them collectively to get their products to market. And obviously if we have people come to us with products that aren't quite there yet, we will help them to develop them, or actually sometimes say that might not work in our context when we see how the health system works, how citizens want to access healthcare, it might not work, but we'll support you to produce something that will work. So the Alliance, not-for-profit organisation, a lot of you will be members sitting around the room. So they have 300 members, and it's actually a great forum for connecting with people around Europe, America and China. So when European bids come out, if we want to bid for something, we'll get in touch with the Alliance and say, have you got a partner who's got the same aims as us, who might be wanting to go for this particular bid, who we can work with to try and draw some funds down from Europe? And very topical at the moment, isn't it, this? So we're hoping that will continue, that we're working with partners to draw down European funds. And we've been really successful, and I know some partners have been successful working through the Alliance to build these partnerships and to have people that you can immediately trust because you know the Alliance know them. So they work across 25 countries, and they have a digital platform that you can connect with partners. So if you're a member of the Alliance, you get access to partners through the platform. As I said, they also work in China, the China Connected Healthcare Alliance, and they run visits out to China to look at how businesses can start to thrive there. And Lisa and Andy from our team went out to China last year to look at some of the ways that we could work with the system in China, and ran a China roundtable a couple of weeks ago. So if anybody's interested in what they might be able to do in China, please do chat to Lisa, who's pulling all that together for us with the Alliance. So as I said at the beginning, we recognise that there are quite a few barriers to getting innovative products into the health system, private healthcare as well as public healthcare, but we want to work with people to break those down. So as well as doing all our local celebration of innovation, pulling people together to look at what's there and developing innovation, we also work on some national innovative schemes to try and get innovation into healthcare. So today we've got 2 National Innovation Accelerator Fellows here. We've got Lloyd, who's talking about Patient Knows Best on the agenda. We've got Francis, who is a European representative for a Life Core with us. And that scheme is about helping develop those people who are running businesses that are innovative, that can make a big difference, and giving them some mentorship and supporting them through some of the complexity of the system. So if you want to chat to them about that, we're one of 5 academic health science networks who sponsor the scheme. The fellows and their businesses have raised 7.65 million this year in terms of new contracts through the scheme, and there will be a new round of bidding coming up shortly for next year's Innovation Accelerator Fellows. So as well as accessing things locally, we do try and do things on a national basis with our other HSN colleagues. We also run the National Strategic Business Research Initiatives, which is a funding scheme for small business to get products into the market, and we do that again with our other 14 Academic Health Science Network partners. So any information on that, staff here will be able to talk to you about that. So the Healthcare Alliance have 2 inter-European groups. One is a Medicines Optimisation Group, chaired by Professor Mike Scott. And Mike is a real force for good in the world of medicines optimisation. He's done a lot of work in Northern Ireland. He leads the European group. We're represented on that. So if anybody wants to know a bit more about that, please do speak to staff again. And there's also a strategy group. We'll come on to some of the strategy in Europe in another slide, just to think about how that might impact on what we're doing today. So Lorna, I've never seen Lorna. Lorna Green's here. Lorna's our commercial director, and Lorna and her team run a scheme called Business Connect, where they work with small businesses to help you to think about what will make your product thrive in healthcare. So if you want to chat to Lorna and the team, they run the scheme for the local enterprise partnerships in Lancashire and Liverpool. Please do that. If you think you need some support in looking at health economics or pathways into health, or talking to clinicians to make sure your product's going to fly, please do chat to Lorna. So we also run study visits, as do the Connected Healthcare Alliance. So we've had a number of visits out to Denmark. Southern Denmark has a really interesting integrated health system, and Britain is moving in that direction. So if you're wanting to think about that, we've been out there. We've run visits to Austria around information governance, and we've got another visit to Austria and Slovenia around radiology systems coming up. So if any of those are things that you think you might want to access, Lisa leads those study visits. So quite a lot going on in terms of thinking about how products can work in healthcare, and systems that may be a bit ahead of our system, but our healthcare system is moving in that direction. As I said, the European Connected Healthcare Alliance are running a mission to China, so if anybody's interested in that, please do let us know, and we'll contact the Alliance for you. So European policy, high up on the news. This is quite a busy slide, but this policy is quite relevant to what we're doing today. So through the Connected Healthcare Alliance, we've been able to work with them to actually comment on some policy green papers and to contribute to how Europe changing direction on some of the code of conduct and some of the policies. So this slide is particularly about lifestyle and health apps. And Europe are thinking about coming up with a code of conduct on what is a health app, what's a lifestyle app, what needs medical approval, how you need to keep apps up to date, and that discussion is ongoing. So the final consultation was held in January. Colleagues have been commenting into that. We should be here something sort of at the middle of this year coming back to that. But what they're talking about in Europe is, do we charge businesses a fee to register a health app? When does the data need to be updated? When do you go through regulation? So it's definitely one to keep your eye on. The Alliance will be working on this and they've had a lot of input into it. But it may affect some of the things we talk about today. So it's just to flag it with you as something that's on the horizon that we all need to be thinking about how it might affect what we do in the app space. So that's my final very exciting slide about European policy there, but I think worth thinking about. We've got around the room lots of suppliers and exhibitors, and thank you ever so much for everybody who's come along and set a stand up. I've already name checked AliveCore. We've got the House of Memories here, that's a digital app around helping people with Alzheimer's to locate some memories. We've got colleagues joining us from the Liverpool Technical College that's all about health, but they're not here yet, I don't think. So these are year 9 students who are training to be healthcare professionals. They actually go to a secondary school that trains them to think about healthcare careers. So when they get here, they might have questions for you about how you've developed your careers, what products you've got. So please do sort of support them and try and answer some of the questions, because I think it's really good for us having them here and developing the healthcare professionals of the future. And if we can help them to think about innovation now, that will make all our lives easy in terms of getting products into the healthcare market. So we'll move on now to our first speakers, and the speakers are Will Sullivan and Jonathan Burr, who I think are sat over here, and they're going to talk to us about their COPD and oxygen service in Blackburn with Darwin.